Okay, welcome back everyone, and thank you very much for rejoining us. So we're about to dive into our next session, which will focus on the research and evidence gaps in eliminating restrictive practices. So what we have is 3 distinguished speakers that will be coming to share their insights about what's missing and what is needed for us to move forward effectively. Each speaker will have 5 minutes to present, and then we'll move into a panel discussion. So to introduce our first speaker is Rod Carracher. Rod Carracher is Acting Deputy Commissioner of the Practice Quality Division in the NDIS Quality and Safeguards Commission. With over 7 years as a Chief Practitioner for a major disability service provider and extensive leadership experience in disability services, youth justice and social housing, Rod is committed to safeguarding the rights of people with disability. So Rod, over to you.
Thank you, Jane, and thanks and welcome everybody. Thanks for the opportunity to talk today, and I'd like to begin by acknowledging the traditional owners of the land in which we meet today. I'm on the lands of the Wurundjeri people of the Kulin Nation, and I pay my respects to elders past and present, and any Aboriginal or Torres Strait Islander people with us here today. So I'm the Deputy Commissioner for Practice Quality in the NDIS Quality and Safeguards Commission. My pronouns are he, him, and to provide a visual description, I have short brown hair, blue-green eyes, and I'm wearing a white shirt and a blue jacket. So current research and evidence gaps. It's a big question and one that has played a significant focus for me throughout my career, and I'm sure it has for many people attending today. So I'm going to outline in brief the research gaps that the Commission has identified as being of prominence, but it's by no means an exhaustive list. Given 5 minutes, and hopefully we can expand on things through the discussion. But for me, firstly, there's a significant gap in the research on the lived experiences of people with a disability who are or have been subject to restrictive practices. People's personal experiences and stories are a powerful driver for change. And while some of this research has been undertaken for people engaging with mental health sector, there has been limited research conducted for people engaging in disability supports. And there is especially limited research on the experiences of people with intellectual disability and complex communication needs, and people with diverse social identities. Secondly, for me and the Commission's focus, there's a need for further research on the drivers of overprescribing of psychotropic medications. There is a lack of robust studies exploring interventions to reduce psychotropic medications for people with a disability, and chemical restraint is amongst the most used restrictive practice in Australia. Perhaps we have a hangover from the medical model. Is chemical restraint a byproduct of a bygone era, a desire to fix or correct through medical interventions? When what we know is that it's not the answer and can make things worse. The extended use of chemical restraint can cause many complications for people who are subject to it. Do we embrace a social model of disability, and does that hold the key? Where adapting the environment is a critical element. Is it a focus on quality of life? And that importance in quality of life reduces the need for chemical restraint to be prescribed. It's certainly a whole lot easier not to start a person on psychotropic medications. And what we've identified is the journey of deprescribing is a complex and if not properly done, withdrawal symptoms are severe and often confused as re-emerging behaviours or mental illness and an excuse to reinstate the medication. So there's definitely more research to be done in that space, and I think it's a critical one for the rights of people with disability. The third, we have a gap relating to supported decision-making and research in supported decision-making, particularly with its interactions with policy and or legislative instruments relating to behaviour support or restrictive practices. There is a need to further examine international examples of supported decision-making, particularly how those frameworks and safeguards are applied in an Australian legal context, and particularly areas relating to dignity of risk and human rights protections. So, for example, can supported decision-making play a legal role in protecting an individual's rights, their right for a review or an appeal when human rights limitations in the form of restrictive practices are being used or considered? Can supported decision-making play a part in strengthening our international obligations under the Convention of the Rights of Persons with a Disability, and particularly in relation to Article 12 of equal recognition before the law, with regards to the use of restrictive practices where people can use the law as part of their human rights and protections? And fourth, the makeup and deployment of the disability support workforce has changed over time, and the casual and agency staff rotations are common factors for people using support staff. This makes consistent application of behaviour support and successful reduction and elimination of restrictive practices a significant challenge, as a stable and predictive environment are critical to success. So further research on workforce makeup, career aspirations and commitments, skills and deficits, cross-sector flows, training needs, and career pathways will help the design of better support models for behaviour support implementation. We know that workforce training and organisational supports to embed positive behaviour support are inconsistent and further hindering effective implementation and the ability to evaluate what is working and what is not. So we need to fill these gaps with stronger evidence, better collaboration, and by centering the voice of people with a disability to create meaningful change. So at the Commission, there's been significant efforts put into identifying the research and good evidence that we use in the development of our policies and education resources and what sets our regulatory priorities. So we draw on the information that's available through data insights, stakeholder consultations, the collaborative research projects that we're involved in, and through incident and complaint reports, we can draw on and target regulatory approaches. The effort we put in terms of our compliance campaigns to target unauthorised restrictive practices and behaviour support compliance has drawn on this evidence. And while there has been elimination of restrictive practices for some individuals through concerted efforts, there's still a very long way to go. And any human rights limitation must not be applied unless it's in accordance with the law that permits it. And it's the Commission's role to ensure that compliance with these laws and the NDIS Act seek to reduce and eliminate restrictive practices. And as Linda pointed out in a previous talk, there is no law that permits the torture, cruel, inhuman or degrading treatment of people. And importantly, research and evidence has helped shape the position on high risk and prohibited practices that must not be used. And I think steps forward, Northern Territory and recently Victoria are making moves to prohibit the use of seclusion for persons under 18. And across the country, the prohibiting use of physical restraints in those physical restraints that are very dangerous to people with a disability. So lots of work underway and lots of things that we're focused on. And I'll pause there and come back to the session later for the Q&A session. Thanks, Jane.
Yeah, thank you very much, Rod, for sharing your insights and highlighting particularly the areas where we really do need more research.